That day was just horrible. Everything that could go wrong went wrong.
Why didn't anybody tell me I look like this?
I was really thinking that my daughter was going to die.
I was taken aback. I'd never seen anything like this before in my life.
Next, 3 medical mysteries that defy the experts. Doctors told Adrienne Beck that her unborn son may be suffering from a deadly genetic defect, but Adrienne refused to give up hope.
I just wanted him out. I was so frustrated with all the ups and downs, and I wanted him to be okay.
Then, Stephanie Kaplan thought she had a simple case of the flu until she found herself in the hospital on the verge of death.
I just remember holding Josh's hand and just looking into his eyes and saying, I love you, and hoping that that wasn't the last time that I would be able to tell him that.
And Scott Gober's doctors searched in vain for the source of his unbearable pain until Scott couldn't take it anymore.
I felt like there were vampires coming and taking my blood.
When illness strikes, we look to doctors to give us answers. But what if they can't? For these unlucky patients, diagnosis is a mystery. In the fall of 2003, Adrienne and Mark Beck, the parents of 4 children, get some unexpected news. 35-year-old Adrienne is pregnant.
This pregnancy was very similar to my other pregnancies. I was maybe a little more tired than I had been with my previous pregnancies.
At age 35, women run an increased risk of having a child with a chromosomal defect. So in her 4th month, Adrienne gets an alpha-fetoprotein screening, a routine blood test to detect her risk level. When the results come back, they show a possible problem.
I have had siblings who had that same test, and the results came back abnormal, and they were worried for weeks, and it turned out to be nothing. So it was a little seed in the back of my mind to worry about, but I just kind of pushed it away.
Although we knew there was some potential for problem, we still felt pretty confident that there would not be any issues.
2 weeks later, Adrienne is back at her doctor's office for an ultrasound, where they learn they're having a son.
We were actually very excited, and we wanted to find out the sex of the baby. That was our main concern at that time. But, pretty quickly turned into a pretty dramatic situation.
During the exam, the technician starts acting strangely.
I could tell by the way he was measuring and remeasuring and taking his time and not talking that something wasn't right.
Based on Adrienne's age and the AFP test, he felt that we were in fact dealing with a baby that had Down syndrome.
Down syndrome is a chromosomal disorder that causes developmental delays. Adrienne is sent immediately to get an amniocentesis. It is the best way to confirm a Down's diagnosis.
When they do an amnio, they take a needle that's probably about that long and stick it in, and it almost feels like you're kicked in the stomach for just a split second. It's a very weird feeling.
But the weird feeling turns to heartbreak as they face the possibility that their unborn son could have this serious condition.
I was just devastated, and I just bawled and bawled.
It kind of began a process of kind of a mourning of there's this life that you've hoped your son would have, and knowing that life is not going to be.
The results of the amnio will take 2 weeks. Mark and Adrienne have no choice but to go home and wait.
Those 2 weeks were so long. Every day you'd find yourself constantly losing focus and wondering how that test was going to come back.
Finally, the call they've been waiting for comes.
A nurse tracked me down on my cell phone, and she just said, "Oh, Adrienne, I needed to find you. I'm so glad I found you."
Then, Adrienne hears words she never expected to hear.
"Your little boy is a healthy baby boy. He doesn't have Down syndrome. He's going to be perfectly normal."
We were thrilled with the news. We felt like we had dodged a big bullet.
So for the next 3 months or so, his life was great, getting ready for this new baby. It was just really fun and exciting.
In her 7th month, Adrienne goes in for another routine ultrasound exam.
And once again, I could tell something wasn't right.
At 7 months, the baby is more developed. Now the doctor can see more details, and what he sees is alarming.
They were concerned about the baby's fists being clenched, the length of his long bones, meaning this bone here, and the long bone in the leg.
He then told us that our baby had a fatal form of dwarfism, that the baby would either die in utero or shortly after birth. Because of the history with this doctor and him being so certain that our baby had Down syndrome, I just felt in my heart that what he was saying wasn't true.
Desperate to find out what's wrong, they seek another opinion. A new doctor tells them that their son doesn't have the fatal form of dwarfism after all, but he can't tell them what is wrong with the unborn child.
We were just so tired of the guessing. It really was just such an emotional roller coaster.
A geneticist encourages Adrian to undergo more extensive prenatal testing, MRIs, and fetal x-rays. But even after dozens of tests, she still has no answers.
We just decided no more ultrasounds, no more testing of any kind. We were going to wait until he was born, and then they could have him there to look at.
On April 23, 2004, 2 weeks before her due date, Adrian goes to the hospital.
We woke up at some crazy early morning hour, 4 or 5 o'clock. I was feeling a lot of hope that after this day was over, that this whole ordeal would be finally done. Things seemed to be going well. His heartbeat was strong through the process, and I think we continued to feel like things were gonna work out.
It was going very slow, and then I finally was able to get an epidural, and it didn't take. Then I started running a fever. None of these things have ever happened to me before. And then after about 5-6 hours of labor, I started pushing.
Adrian worked and labored and pushed to the point of near exhaustion, and the baby's head was just not advancing.
And I finally just said, you know what? I need a cesarean. Just get him out. He needs to get out.
As we headed off to the operating room, I was just thinking, just a few more minutes, and this will be done. We'll be on our way. So when they lifted Wesley up high enough that I could see him, and I got the first look at him, and at that moment I knew that my son was not going to have a typical life.
Before Adrian can even see her newborn son, whom they have named Wesley, doctors rush him to the neonatal ICU.
Adrian called me over and asked me to describe to her what I had seen. That was very hard to do.
It's not good. It doesn't look good.
For the last 5 months, Adrian and Mark Beck have been plagued with worry about whether or not their unborn son has a serious genetic defect. When he's born, doctors immediately rush him to the intensive care unit. It is hours before Adrian is allowed to see him.
So at about 2 o'clock in the morning, they came and got me and let me go and see him. And he looked sick. He definitely looked sick.
Wesley's hands and feet are twisted and curled. His facial features have a distinctly strange look to them. They also discover that the newborn has no suck-swallow response. He won't be able to nurse or drink from a bottle, so he must be given a feeding tube.
I wanted so much to know what was wrong with him. I welcomed anyone who maybe had an opinion or had an idea.
Soon after birth, a geneticist is called to check Wesley out. He draws blood and runs a battery of tests. Later, he comes back to share his findings with Adrian.
As I was driving out to pick up the children, the phone rang. It was Adrian, and Adrian was very upset and was crying.
They had a chance to look over Wesley, and he said he thought, from the way Wesley looked, that it looked like he had a syndrome called Zellweger's disease.
Zellweger syndrome is a rare genetic disease where the body's cells can't expel toxins, which build up in the brain and other organs. Infants with Zellweger's usually die from respiratory distress, internal bleeding, or liver failure.
The prognosis that he gave was that Wesley wouldn't live till he was 6 months old. That would be the longest that he would live.
Although the geneticist is pretty certain, he still has to order a test to confirm the diagnosis. It will take 2 months to get the results. The Becks are devastated. If, as they have been told, Wesley is going to die in less than a year, they want his life, however short, to be full of family, not hospital equipment. So after a little over a week, his parents bring him home.
So for the first several months of Wesley's life, we felt it was important to hold him all the time, 24/7. And although we didn't know how long we were going to have him, we wanted to have him as long as possible.
I definitely felt like I was a first-time mom again. I felt like I couldn't do anything right. So that was really difficult.
He is such a sweet little boy.
Then, finally, the Zellweger tests come back.
And lo and behold, results say this is not a case of Zellweger syndrome.
It was a pretty sweet moment, the relief that flooded out of me, you know. We just felt like, okay, this kid has a chance. We went ahead and just decided we were going to treat him like the rest of our children.
But clearly, Wesley is different from the other children, and the Becks are certain the answers are out there.
Okay, it's not Zellweger's. What is it?
And so more blood was drawn and the tests were started again.
As the days turn into months, the Becks find themselves spending more and more time in the geneticist's office.
I remember sitting in his office one day and he would pop out of the office to go look something up. He'd come back in and say, "Does Wesley have fat lips?" And we'd look at his lips for a minute and he'd say, "No, he doesn't have fat lips." And he'd come back and say, "Do Wesley's fingernails do this or that?" At the end of that, he said, "You know, I think the best thing to do is just let's wait 6 months."
But waiting is not good enough for the Becks. They continue seeing specialist after specialist to try to figure out how to help their son.
Orthopedics and geneticists and others. And the bottom line was they did not know what was going on here.
Still, despite the grim prognosis he was given at birth, 7-month-old Wesley seems to be thriving. He's put on weight and is rolling over.
In August, he smiled for the first time. And that was a tremendous relief to us because the neurologist had told us that smiling would be a good indication that his mental capabilities would be good.
Although Wesley has lived longer than doctors ever expected, the Becks still don't have a diagnosis. So in November 2004, they turned to a new geneticist, Dr. Joan Stoller at Massachusetts General Hospital.
When I met Dr. Stoller, my impression of the medical professionals at this point was pretty low.
They wanted a diagnosis and they wanted to continue, but I'm sure they were very tired of the whole process.
She asked a lot of questions and reviewed his history.
When he was born, the features that he had were somewhat distinctive, but his skin was really what struck me, and somewhat of the sort of the gestalt of his face, but not at that point indicative of a particular disorder.
Dr. Stoller orders x-rays to check for skeletal malformations and takes photographs of Wesley's strange features.
She said, okay, I'll look into this and we'll see what we can do.
When I first saw Wesley, I was thinking that perhaps he did have a type of skeletal dysplasia, type of dwarfing condition. The x-rays turned out to be fine, and I started to look up different things. We have a couple of computer programs, and also lots of books. And I said, okay, if I put in this deformity of the hands, the short stature, and this thick skin, what do I come up with? What else could this be? And then it just came to my head.
Down syndrome, dwarfism, Zellweger syndrome. Since before he was born, Wesley Beck's parents have been tortured with terrible misdiagnoses of their son's mysterious condition.
The entire experience was a major roller coaster ride.
But after a series of tests and a detailed analysis of Wesley's condition, geneticist Dr. Joan Stoller believes she's finally hit on a diagnosis for this 7-month-old baby.
She called me up and said, you know, I think that he has this syndrome called Costelo syndrome.
Costelo syndrome is a rare genetic disorder diagnosed in around 250 people worldwide. In Costelo, scientists believe that a defective gene relays faulty information to cells in the body, causing certain organ systems to develop abnormally. This in turn leads to the distinctive facial features, delayed cognitive development, short stature, and loose skin on misshapen hands and feet.
My first reaction to this news was fairly cynical. But then I went on the internet and found a website. It had pictures of babies who had Costelo syndrome. And I think we didn't take very long for us to believe that Wesley was in fact a baby who had Costelo syndrome.
Geneticists believe that the defective gene also puts a Costelo child at greater risk for heart problems and cancer.
We don't know exactly how that works because the gene has just been found, but it obviously involves many different organ systems. It involves the skin, it involves the lungs, it involves the heart, and also it has a propensity for tumor development.
There is no cure for Costelo syndrome, but vigilant medical care can help monitor and treat any complication that may appear.
It's a rare diagnosis, so we don't have a lot of information about the lifespan of people with Costelo syndrome. We do know that people can live into young adulthood.
Before we got the Costelo diagnosis, we didn't know if he was going to live or if he was going to die, and Costelo syndrome was like huge.
Today, Wesley, now almost 2, is the joy of his family's life.
Wesley today is just a sweet little boy. He is stronger. He can let you know what he wants.
He has a terrific smile. It just lights up his whole face.
He will make developmental gains. He will be able to walk and talk. He will be able to enjoy things.
My son's gonna walk, he's gonna talk. I remember thinking he's gonna put his little arms around me and give me a hug someday.
The Becks are happy to finally have an answer, but still wonder why the road to the right diagnosis was so long and filled with so many false leads.
I think making diagnoses like this is often being a detective. One has to take the pieces of the puzzle, put it together, or to try to make a pattern of the different features.
And making a diagnosis in utero is even harder.
During pregnancy, we have ultrasounds where we can only tell so much. I don't think anyone in their mind would have thought about Costelo syndrome at that point.
I have always been in awe of a doctor, but this experience has taught me that they're relying on things that aren't 100% reliable.
I've learned a lot about how the medical profession operates, and more often than not, the answer is that we don't know. So, you gotta push back, you gotta ask hard questions.
Even before he was born, doctors suspected Wesley Beck would have problems.